My story began with a death sentence.
My beginning is before AIDS.
She talked about this new disease. It was going to change the face of medicine in South Africa.
Very few of us had any understanding of the epidemic.
Really, I had absolute, complete faith in the fact that, science would prevail.
When the epidemic first came, I thought it really didn't concern us. It was a problem of white gay males in California, and that was a dreadful mistake because, as you've seen, from the 80s, we've become the worst affected country in the entire world.
We had HIV. We didn't have the drugs at that stage.
The drugs haven't arrived.
Who could afford to be on the antiretrovirals? And you were talking about $10,000 a year.
Yeah.
We had this real view that there was new hope. I think we were all a bit patient. We were saying, Mbeki comes to power and we need to allow him a bit of time to bed down. Same was true for Mantu.
What I kept hearing was, you wanted a policy on treatment, you've got it.
Some of the memories I have is of a lot of people dying, a lot of friends dying, personal confrontations that I had which were unpleasant with the former Minister of Health.
It was already known that the infection in children can be prevented, and yet they were still dragging off feet.
There was a bit of conflation of the issues. We then got into a bit of a debate which polarized us as a country.
As we grew, AIDS denialism hardened. As it hardened, we had to fight it harder. As we fought it harder, Thabo Mbeki, being a proud and arrogant man, hardened his position further, and unfortunately we got into a kind of, I think, vicious spiral.
There were very few people who supported us fighting Thabo Mbeki. And within the government itself, if there is a handful I can think of who stood up, it's a lot.
From an international perspective, we were embarrassed.
Bearing in mind that it's always been the case that an effective response will have to be a national response.
What moved and inspired and motivated you in those days was the personal interactions with people.
I think it's right to capture this history.
I am a regent, which means that I'm holding the throne for my son. As the father passed on in 1996, my son is no more young, but it's just that he is still trying to get more experience to work with communities before taking the throne. And also the members of the family members are also supporting that, because before working with people, before taking that throne, you needed to have experience in working with other people around, because that sometimes traditional leadership will make you work in one place. But it was like that before. But now, at least now, we are exposed to other areas. But he's still interested to do more, as he has done civil engineering. And the government and other people are also encouraging us as traditional leaders to take our children to school so that they will be able to face with the challenges of the country now. Yes. Usually before, the throne was usually taken by the uncles, but it was noticed that when the child is grown enough, there were fights and everything when the child is supposed to take the throne. Now it was decided that the mother must hold the throne to avoid that. And you'll be able to educate other children, because when you are talking about the heir to the throne, you still have a responsibility to take care of other children. So when you give this to the uncles, they've got their own responsibilities, so they won't be able to take care of you as a mother of the child and the other siblings. So we appreciate that, and even in the Constitution, the issue of equality, it has made us comfortable now as women. I came here as the member of the National House of Traditional Leaders. That is the National Parliament of Traditional Leaders. Each province is represented by 3 representatives. I'm one of those representatives from Eastern Cape, and I'm the leader of delegation from there. Now, the National House was also invited to this conference, as it is also participating in SANAC. So as members of SANAC, as we are there as different organizations there, each and every organization is expected to go back to their counterparts. That is for us is provinces. So as we are at the National House, we have got different committees. So those committees, each and every province is represented there in each and every committee. So I'm going to report back to the Social Development Committee, which is dealing with the issues of HIV and AIDS. Then the chairperson of the committee was supposed to be here, and the chairperson of the National House was supposed to be here. So now my role now is to go back and report to the committee. When the committees meet, they also have their different fora, which is made up of different provinces. That is social development from different provinces to share whatever information they do have. And then we've got also local houses with same arrangement, and we go down to the traditional authorities, that is traditional councils. So, and it is very easy if you are working together, you report back. As provinces, we are also participating in the provincial AIDS councils. So it is easy for us to communicate with the provincial structures as we are also participating in the national structures. My first experience is not a nice one, because when I experienced that, I'm a nurse by profession. So I was a nurse working in the pediatric ward. You can imagine how AIDS was, the patients with HIV and AIDS were treated before. Everybody was afraid of them. And you'll see some, when they've passed on, you see the clothes and everything, belongings put in a plastic bag and what. That was so painful to experience, especially for children, as I'm working with children then. I was always thinking, why now? Because the children are the gifts of God. Why God would allow that? Because I was concerned about children, the future, our future, which is children and youth. So it was very painful for me as a nurse. And you'll see that they are treated differently. And that was the instruction we got as nurses before. Need to be very careful and what. But now, as we see now, as time goes on, everybody now, you could even not know how it's being transmitted exactly. You'll be even afraid of using utensils like spoons and what, thinking that can be, you can get it from eating with spoon, which was used by that patient. So, but as time goes on, everything was clear. So that was my bad experience because I love children. It was, yes, 1990s, yes, because I trained for nursing from 1987 to I started working from 1991, yes, 1991. So you can imagine what was happening by then. Yes, I watched it growing, but by then there was not much, especially from the rural areas, especially for the rural areas, even the information. It was not easy to access information. Yes, even now for some areas, deep rural areas, it's not easy to access information about HIV and AIDS. So, but it's better now for other areas. Yes.
You must have seen a lot of people dying.
Yes, there was no medication, and there will be those people from the traditional healers, those who will be saying that no, we do cure AIDS and whatnot. So people from the rural areas were prone to that, and you know, sometimes in our rural areas, this HIV and AIDS was also linked to the issues of what do you say? Those people who are killing others. Witchcraft.
Yeah, witchcraft.
Yes, it was always, and it is still like that. So it was worse by that time. Most of the women will be killed, saying because of that. So women were prone to that because there was not enough information about the signs and symptoms. So when people have got those hallucinations and what, they'll be saying that they are seeing somebody else, and then people will be killed.
So women with HIV were accused of being witches, of witchcraft?
Not exactly. Those were ill. When yes, so those were ill. They'll be saying, no, I'm being witchcraft by somebody else. So you would see a lot of people, the houses burnt and all of that. But as traditional leaders, we decided to join hands with the department to try that people get more information about this, because this must not be linked to witchcraft and other things, because HIV is there. We needed to join hands. So as the traditional leaders, the other reason that it was key for us to be part of SANAC is because of those cultural practices. Some of the cultural practices, yes, they do assist to limit the spread of HIV and AIDS. But there are other cultures which are harmful, especially to women. For instance, when you are talking about, maybe you won't understand, the issue of inheritance. When I have lost my husband, then there'll be somebody from the same family who will be coming and then inherit me. So, and the issue of and other the forced marriages and what. But those issues now, they are discussed openly, because as women from the traditional communities, we raise those issues, and we are getting a positive response from those from other traditional communities and traditional leaders, because they do understand now what is happening. Yes, a lot, but we still need to do more, because some will be saying that I'm doing this because of culture. Yes, I'm forced to do this because of culture. So we are trying to fight that. They whenever somebody is doing something wrong, must not hide talking about culture. Culture must be clear, and we need to. Culture is supposed to be dynamic. It is supposed to go with times. Yes, because now we've got a lot of challenges. We For instance, I'm the chairperson of Imbumba Yamakosikazi Akomkhulu, which is a group of women, wives of traditional leaders in Eastern Cape. Now I'm the chairperson of that organization. That is where we are trying to discuss these issues and check what can we do about the behavior. Because when I talk about some cultural practices, those are behavior. For instance, the issue of polygamy versus HIV and AIDS now. We raise those issues with traditional leaders, male traditional leaders. How can we deal with that one? Because now polygamy was there, but now, then polygamy now, is it still relevant? Or what can we do if it's supposed to be there? What can we put so that we are not prone to HIV and AIDS? So we raise those issues, those issues of inheritance and other issues. And the other issue, the burning issue, especially in Eastern Cape, that the forced marriages, especially for children, yes, still under age. I don't say it's good for the elderly youth, but the children who are still at school, so killing the future of the children. That one we are doing very well with the House of Traditional Leaders in Eastern Cape. So they are also fighting against that, because those people are saying, no, it's because of culture. But also women, the mothers are also saying they are poor. They would like to get something from when their girl children are married. What about the child's future? Yes, we do. Because in some conferences we come together. For instance, we have just had a conference on South AIDS. With South AIDS. So there were different countries there. Those issues I'm raising, which are affecting women, we're discussing with them, and most of them they acknowledge that there are challenges. So some will talk about those, stick on the issue of culture, as it was raised during the other sessions here. Who identifies the proper culture? Which culture can you say, this one is mine, this is ours? So we need to check on those issues, but we don't want to run away from the activities which are assisting us to reduce the scourge of HIV and AIDS. But we need also to check on those practices. What is exactly what was interesting? Some of discussions when we were talking about the virginity inspection, the other lady was raising the issue that as women we are busy with virginity inspection. Are we saying that really we agree that we are the ones who are spreading the disease? Why are we saying that no, we must be the ones who must be inspected? Are we agreeing that we are the ones who are spreading the disease? But before, those questions were not there. That we were just as traditional leaders doing what was done, and we know that it goes together with the behavioral change and what. For instance, when you are talking about the initiation at large, not a circumcision or girl what inspection, but in initiation. But or we are talking about a circumcision. There are other issues there. If we are talking about that, there are lessons which is supposed to be some lessons which are taught to those boys about manhood, about the responsibilities of a man. The man is regarded to be taking care of the family, as we know. But now, if that is done properly, that's why, for instance, in Cape they've decided to form some fora so that they can see what is being taught them, why those boys are coming back still doing those bad things when they are back from the mountains. Whereas we expected them to behave very well, but it seems as if now others will go there with before they went there. They were not smoking, but coming back, smoking everything with bad behavior. So they are going back now, the traditional leaders, then, to find out what is being taught them must have fruits, so that we can be able to see as the communities that those are from there, if the purpose is that. For instance, even now, there are those cult areas you can't talk about it. For instance, in Matatiel and other areas, they don't even want to talk about it. What we are saying as women, the weakness the men are having, whenever there's something mentioned about circumcision, they will just think about that. They will just think that we are interested to know more about what is being done there, but we are concerned about the issues to be discussed. For instance, there are burning issues. For instance, in Eastern Cape, that is part of Pondoland, where women are accused of giving children money of young age to go for circumcision. Those issues are supposed to be discussed by women, so that we can talk to other women as leaders. So because they don't know that they are doing wrong. So if you just see the name circumcision, you just run away. What is important for men? Whenever, if they want secrecy to be there, they better, when we are together, discuss issues, just general issues. Maybe someday just burst out and talk about their issues. We are not interested what is exactly happening there. We want to know, get the fruits. When the man is coming back, I'm expecting my son, if the father is not there, to take care of the family. I'm the mother, but there are things that were supposed to be done by men there.
So you're demanding accountability.
Yes, accountability, which is important. Yes.
That's very interesting.
But being a female traditional leader, sometimes there are challenges, because sometimes there are challenges amongst the community. Men, they still regard you as just an ordinary wife, but some will regard you as a leader. But also it depends on your capability to deal with the issues, so that they can see you can do whatever is being done by men. You must not regard yourself as just somebody, as a woman. Just regard yourself as a leader whom the community is looking upon. So you need to do everything as a leader. Don't regard yourself as just a woman. Yes, it has, and because we have got more platforms to discuss issues now, issues of gender, and encouraging women to come up. For instance, it was difficult for women to go to our meetings. As you know, before, when you're talking about traditional leaders, that is the chiefs and what, you'll be thinking about the kraal.
Yes.
And for us as traditional communities, as a woman, it's a taboo to go to the kraal.
Yeah.
You can't go to the kraal. So now, where the meetings now are no more held around the kraal. The meetings are held in our traditional councils, halls, and structures, so that women can be able to come and discuss issues without interfering on the issues of culture and what. So they are able to come. We encourage them to speak now and talk about their issues And they are coming up really, but we need to do more to encourage them, because they still regard them as non-entity. They don't, they still feel small, whereas they've got capacity. Yes. No, really. No. Maybe they don't say it out. But around my area, really, they support me very well. Even in the house, for example, starting from before going to the house of traditional leaders, you're starting from your district. That is, I'm coming from Pedi. That is my district. That the traditional leaders of that area regarded me as the leader of their leader to take me to the provincial house. It means a lot for me. And also the support we got from our king, King Sandile, that's our region. He is always supportive to women. He's always encouraging women to come up. So even in the provincial house, my provincial house, they regarded me as the leader of delegation. We are 2 women representing Eastern Cape in the National House with 1 male, which means a lot. We are leading by example as Eastern Cape. So that it means a lot. But also it goes together with your commitment. You don't look down upon yourself. You need to take yourself as a leader, not think about, no, I'm a woman and a woman. It's not that they were doing a favor for us for the gender issues. They have noticed that we have got capacity to do that. And I'm not afraid to say it. It's very interesting to work in the traditional leadership.
Yeah, no,
yes.
I'm really learning a lot from this. I was
yes.
quite ignorant before.
For now, we are also busy with this campaign of HCT. We are working together with different, according to the Act 41 of 2003, Traditional Leadership Framework Act 41 2003. All the departments are supposed to work with traditional leaders. So our province is doing very well. We are working together. Now we are also participating in this campaign, HCT, and they are coming in numbers. They were just phoning me, the AIDS Council, that is ICAC, Eastern Cape AIDS Council, they were just phoning me on my way to this conference saying that, Mrs. Mhlauli, you are doing very well because women, the women traditional leaders are leading the campaign there. So, which is very interesting for me. And also, it's not only about that. We are also on other development projects working together with Department of Social Development, Department of Health. We have been trained on issue of cancer and other issues a lot. It's a lot. It's a lot. We also, in Eastern Cape, we did have a research, which was because we don't have the capacity to do the research. And in partnership with the Medical Research Council, they did go to the initiation schools and got all the information from them, and they have got
That was allowed?
Yes, it was allowed. It was allowed. They did go there, and then they got everything from the initiation schools, and the report was just tabled to the Premier of the Eastern Cape. So it's a lot. So we are doing a lot because we know how to do it. Because we need to get more information from the youth, what their beliefs and what. So it's a lot. If you can get that report, it's very important. So other people will be saying, traditional leaders and research.
I'm an anthropologist.
Yes.
Traditional leaders are very important to me.
Yes.
But I wanted to ask you something else. Do you think in the other provinces in South Africa, are traditional leaders working as well as you are?
They are working very hard. But it's just that Eastern Cape is always leading in the other issues, but they are leading other issues who are different really. But Eastern Cape, they are always looking at Eastern Cape but they are also working very hard because we are so diverse, but we are trying. But as the National House, we wanted to, would like all the provinces to come up. So that's why we are so trying to attend in each and every conference so that we can come and go and report back. But some time before, we had a lot of trainings and what. You know what was happening really? Where it's not a good experience. Where you will be you will be invited for training, and traditional leaders come, train them, then and so what? Because we are just a huge group, and so what after training? So a lot of money has been used, and what it was some years ago. If you still remember, people were just called to the boardrooms and what for training, and so what. But now we are happy that we know what we are doing. We know how to take the resolutions forward of each and every conference. We've got our structures to work with. And we're always happy to work with different organizations. They are always coming to our national house or provincial houses. It depends on the provincial houses whom they are working with. For instance, in Eastern Cape, we've got a memorandum of understanding with different organizations. There's NGOs and other departments, so that we can work together. And it's very interesting if you can go down to deep rural areas. I was saying when I had a comment yesterday that whenever we are talking, we must always remember that there are those who don't have access to information for the future generation. But first of all, I would like to say we need to have more discussions with children and youth, because sometimes we tend to make decisions for them. Yes, we need to have give them guidance, but sometimes we need to have more platforms for discussions, because that is where we can get more information of what they are thinking and of what is happening to them. And also the issue of human rights, when talking especially about the children and youth. Yes, there are rights, but we always forget to talk about the responsibilities, because each right goes together with a responsibility. But we always focus on the rights. But also as parents, we must also consider that we have got a responsibility to make sure that children and youth are taught properly, are nurtured properly. For instance, if you can talk about human rights, say, no, I'm no more going to say anything to my child because of human rights. What are you thinking about your responsibility as a parent? Where a child will be saying, now I'm here in this position, in this trouble, because my parent or my mother, my father, didn't do what was supposed to do as a parent. Because you know, children will be always children. So you need to make time, as we are all working, but we need to make time to sit down with your children. And in your house, there are values of the family values or the house values, you know. But as the child is growing up, yes, there's peer pressure, but she or he will be able to pick some of the values whenever he or she is going to, she'll be thinking about those values. You can't just run away from your responsibility as a parent, saying that, no, because of human rights. Why are you going to run away from your responsibility as a parent? And so on this issue of culture and what, as I've said it before, yes, the culture is dynamic. But I can't say to you, no, don't talk about culture to your children, because they are different cultures. And as we are here now, we are from different organizations, and we are here to discuss about what can we do about HIV and AIDS. I'm sure it's important for us not to attack each other. It's important to advise. If you have got, for instance, you've got a legal perspective on the issue of culture, why don't you come to that particular organization and then try and explain what is happening now, all the legal imperatives on that cultural practice, rather than shouting at the big wall, saying what. Whereas those people who are supposed to listen to are not here. It's just one or two people. And as for academics, they are there to assist us as communities, to go back to us and say, now we are coming back to you, plowing back to you the knowledge we got when we're far away from you. So can you see that this one is dangerous? This one is not supposed to be there? Or do you understand where did this come from? And then the people will just sit down and listen. The communities will come, will listen, because information is power. So people will carry on practicing the other cultural practices, which are no more allowed according to the Constitution. But if those people who are knowledgeable, they don't go back and then capacitate those who are down there, what is going to happen? Are we going to be attacking each other? I would be saying most of them died because of HIV and AIDS, and HIV and AIDS related diseases.
But why couldn't we stop them now?
I would be saying it was big, but if you can compare different years, you'll be seeing that maybe there was something which was done, and at least the mortality rate was going down a little bit, even if it's about 1% and what. But it was not easy because, for instance, if we are working in silos, not working together, putting our resources together, so it's not easy to get the fruits of what you are supposed to do. So I would be saying to them, it was because we're still trying to work together, but it was not easy. And for instance, we've been talking about the NSP. The NSP, we've been talking about it, but it's in implementation. It's not so easy because now something now is coming up that there are those who are not involved. For instance, when you are talking about youth, there's a feeling that they were not more involved when we're talking about NSP. So it's just that now we see how we have gone wrong, but we would like now to move a little bit faster because people are dying. And I would be saying to them, especially to rural areas, there's still not enough information. In rural areas, there are no resources. For instance, where you are staying, you have to cross the river to get the services. If even now it's raining, how do they get the services? How do they get their treatment, even those who are on treatment? So it's a lot you can talk about, the challenges we're faced with. But it would be better when I'll be talking to them, I'll be just telling them that now at least we've got something. I've been also telling them that we have been struggling to get medication. Tests for everything, they take a long time, years and years and years, and then there have been promises that there'll be medication, but the tests show that it's going to take a long time. How long is it going to take before a lot of people are dead? A lot of generation. I'm sure maybe for us as traditional leaders, others will be asking why your ancestors will be allowing people to die. As we are talking about the tradition and culture, yes, and also for faith-based organizations, they'll be asking why God would allow that. Really, those questions will be, are always there, but we'll be just saying it's because of the scourge of AIDS. It's there, so it means that even the ancestors, they don't have the answer to that, which means that we need to come together as different people now, because even the faith-based organizations, maybe they'll be saying now, it means that time has come now. It was said in the Bible that you'll see by the lot of diseases and what. Why our generation? That's what I've been asking. So which means that we need to come together and see what we are supposed to do. And I was down there. I heard about the revival of the primary health care services, which was very good before, where the school health, there were school health services and what, which means that it's not one person's thing. We need to come together. We need not to try and say, no, this one is doing wrong, this one is doing wrong. Let's just come together with all the resources we are having, not work in corners. But there was something which was raised also, that we are, as South Africa relies mostly on donors. For HIV and AIDS, that issue was raised there. That is a very big challenge. If those donors can just decide to withdraw their resources, what is going to happen if we don't have plans as South Africa to deal with the scourge of HIV and AIDS? So being in this conference, it was very interesting for me to get more information so that I can take it back to the traditional communities, also to share our experiences as traditional leaders, to share information with everybody who is here, because I enjoy sharing information so that we can be able to work together. Yes, and I also wanted them to know that we are here as traditional leaders, so that whoever would like to share information concerning traditional leaders can be able to say whatever they would like to say.